Well, welcome everyone, and thank you for joining us for today's webinar, which is just going to be a bit of a general chat about hip and knee arthritis. I'm coming to you today from sunny Oamaru, and Sarah is joining us from Wellington. So by the magic of technology, we can have this chat with you. So I'd like to introduce Sarah Tulloch. She is a qualified physio based at TBI Health in Lower Hutt. Welcome, Sarah, and tell us a little about you.
Hi, thanks, Cathie. So I've been a physio for 15 plus years, and for the past 10 years or so, I've been practicing at TBI Health in the Wellington region. So first in the CBD area and now in Lower Hutt. TBI Health is a multidisciplinary rehab company, and we provide a comprehensive injury management and rehab service. And one of those services that we provide is a hip, knee and spine osteoarthritis program, which here in the Hutt is funded by the Hutt Valley DHB. This program is an 8-week program, and it consists of physio assessment, customised rehab program, education sessions regarding pain management, both medication and exercise, stress and sleep management, and nutrition.
Well, that sounds like a great program. I think it's commonly called the MAP program, isn't it, in the country?
Yeah, so it was called the Mobility in Action program, and that was originally funded by the Ministry of Health. And that was a pilot scheme, which was then picked up by the DHB here in the Hutt Valley.
Right. And it does operate in other parts of the country as well, doesn't it?
Yeah, it's different regions. So Waikato have a spine one, and down in Nelson, Marlborough region, they've got hip and knee as well.
Right, okay. So how does someone get referred to the hip and knee arthritis program? How long's the program and what's involved?
So you can self-refer. So if you have a diagnosis of osteoarthritis, you can self-refer to the program, or your GP can refer you into the program. Or if you're lucky enough for your GP practice to have a hip health improvement provider, then they can refer you to the program too. And what's involved is, like I said, so a physio assessment and then 8-week program, which is mainly rehab based, but we do have education sessions as well, which are run every couple of weeks.
Right, so it's quite a holistic focus.
Yeah, I mean, more research that is coming out is that the management of arthritis isn't just about the joint. So you have to factor in weight loss management, nutrition, other comorbidities like diabetes and heart conditions will all affect your levels of pain. And we know that exercise is the first port of call for remedying all of those conditions, and improves your overall quality of life and not just the pain that you're feeling from the arthritis.
Now, for those that have joined us, you may have some questions. We will answer those at the end. So if you can just push the question answer function or the chat function, and we'll come back to those a little bit later. So I understand that the map's not available in all areas, Sarah. So can people still access a physio for hip and knee issues? And what's the process for that, if so?
Yeah, definitely. So any physio will be able to help you with hip and knee or any kind of joint arthritis. Since it won't be funded by ACC because it's a degenerative condition, you would have to access the service privately, so be a privately paying client. Alternatively, if you can't afford to pay for physio, then your GP can refer you to your local DHB, and they have physios there who can help you manage your pain with your arthritis.
Right. And I'm imagining through the DHB, there's possibly a bit of a waiting list for services.
Yeah, I mean, all DHBs are different, but I know here in the Hutt Valley, it's up to about a year.
Wow.
Yeah. So
Okay.
they will triage their wait list, and often they'll be pushing some of those people back onto us to see if we can see them quicker.
Right. And accessing the MAP program, is that fully funded or partially subsidised for people?
Yeah, so it depends on the area that you live in. For the Hutt Valley one, if you are Māori or Pacific Islanders, have a community services card, or live in a quintile 5 area, then it's all fully funded for you. If you don't qualify, then you still can qualify for the partially funded program, which here is $35 for an assessment and then $120 for the 8 weeks. So it's for the benefits to your health, it's a minimal fee.
What are some of the common complaints about hips and knees that people come to see you with?
So mostly pain. So that would be the biggest complaint that people have with arthritis is the pain in their joints. Loss of movement, so loss of flexibility, difficulty walking or doing their normal ADLs or activities of daily living, and poor sleep. That'd probably be the main complaints that people come with.
So I understand there's no replacement for personalised assessment and advice, but do you have some common exercises that you prescribe for people with hip and knee issues?
Yeah, so the main thing that you want to do for any load-bearing joint is to actually use it. It's like use it or lose it. The less you walk and the less you do activities, the less muscle tone you have, and then the less support you have around the joints. So we want to do exercises that strengthen those muscles. So strengthen the quads muscles on the front of your thigh and strengthen the hamstrings and the glutes at the back. So it'd be things like step ups, sit to stands, squats, calf raises, leg extensions. There's at least 10 to 12 exercises that we do as part of our group class that we will give to people for hip and knee strengthening.
Right. Cool. And I think in our exercise brochure that we have on our website, we do have quite a number of those particular exercises as well. So people can access that through our website, or just send us an email and we can send you the link.
Yeah, and they're common ones that you can do at home. So, you don't need specialized equipment. You can
That's right.
Out of a chair. You can, use a couple of stairs at home.
So some exercises that people can more easily start to implement into their own daily
lives. Yeah,
which is important. It's always hard when people are doing something in a gym type setting and then that class finishes. It's good for them to have some things that they can continue to do at home and some homework as well, I guess.
Yeah, absolutely.
So what tips can you offer people for managing hip and knee arthritis, Sarah?
Just keep moving. So rest doesn't help is probably my number one tip. So try and move within what you see as your limits of pain. So we kind of use a traffic light system here. So green is you're good to go. You can do as much activity within that kind of pain level as you feel that you can. So we kind of go from 0 out of 10, 0 being no pain at all, to a 3 out of 10, which is discomfort but not too much pain. So any activity in that level is fine. 4 to 5 is called our orange light region, and that's it's a bit more uncomfortable, and you might need to have a little rest after doing that kind of activity. And then anything above a 5, sort of 6 to 10 is our red light. So you don't really want to be pushing into that range because it's harder to come back to a nice baseline level.
So sort of follow it, finding that sweet spot. of
Exactly, yeah.
moving, but just pacing yourself, not overdoing things.
Yeah, not thinking, oh, I'm feeling good today, so I'm going to do heaps and then pay for it the next day. We want to do little and often, and the more you do that, the weeks down the track, you'll find that you can cope with more.
And we have a saying, don't do more on a good day than you can do on a bad day.
Yeah.
So just pacing yourself so that you're not doing that boom and bust cycle, and which can be very tempting as humans.
Yeah, and also don't fear the pain. So the pain doesn't mean that you are causing yourself more harm. It can be a sign that there is a bit more inflammation. You may have had a bad night's sleep, or something else is stressing you at the moment, which causes a big flare in pain. It doesn't necessarily mean that there is more damage going on in your joint at that time.
Okay, that's really good to know for people. Yeah. Now, it looks like we might have a question here, Sarah.
Oh.
Question from someone that says, do you think 44 is too young for a hip replacement?
It all depends on the individual's circumstances. 44 is pretty young, and if you haven't tried a good amount of conservative care first, so like a good physio strengthening program, then I would be hesitating to go for a hip replacement right now. What else can I say about that? That's a really hard question to answer without knowing individual circumstances.
Yeah, that's right. It is a tricky one. I think it's certainly not outside the realm of possibility if, as you say, all those conservative things have been exhausted.
And I do know, there are people in their 40s, especially ex-All Blacks, who have had replacements, in their 40s because they have had a really tough life. They've done lots of damage with previous injuries, and they've done all that rehab, and that's kind of the final straw, really, is getting the replacement.
Yeah. And we at Arthritis really encourage people to look at that holistic management, strengthening and doing exercise, as well as that holistic management as a means to try and mitigate symptoms as much as possible and avoid hip replacements. But we do understand that for some people that is the best outcome. But there's certainly some other things that we can try as well, or alongside.
Yeah, we have to remember also that hip replacements or any kind of joint replacement isn't going to necessarily take all your pain away. And I think that's what people think. They're looking for the magic bullet that, if I replace the joint, then I'll be able to function as normal, I won't have any more pain. And that's not the case in at least 20% of cases.
And I guess, that's true if you've got muscle imbalances or weak muscles outside of those joints, then yes, a lot of that pain from the degeneration of the joint will be gone, but still, you're going to have some discomfort possibly if you are still got that same weakness in those surrounding tissues, right?
Oh, absolutely. Yeah. If you can't strengthen the muscles up post-surgery, then you're still going to be left with the same problem that you had pre-surgery.
I think that's a really important point for people to understand as well, that there is some ongoing maintenance that needs to happen after you've had a joint replacement too. It's not necessarily going to be a magic bullet in the short to medium term. That's really good information, Sarah. So it looks like that's the only question that we have.
Okay.
So I really want to thank you for popping on today and answering some of our questions about hip and knee arthritis. I understand that, it is a fairly individual thing from person to person, and for people to, seek a physio's assessment and guidance with their hip and knee arthritis. Looks like there are a number of different options for people, be it through the DHB physios, privately, or through the funded MAP programs throughout the country. And I encourage people, if you haven't explored that option yet, then that certainly is a valid option that can help a lot.
Yeah, definitely. But one last thing, there is a recent editorial in the British Journal of Sports Medicine about changing the narrative about knee osteoarthritis, and it does talk about all the passive treatments and everything that we traditionally relied on, how they aren't very evidence-based, and how we need to be more holistic, which is what you're talking about. So I might send that article off to you as well.
Yeah, that'd be good. Send me through that. And if anybody would like the link to that, they can contact us at Arthritis New Zealand, and we will send it on.
Cool.
So thank you, Sarah, and we may chat with you again in the future.
Thanks, Cathie.
We'll talk to you later.
Bye. Bye.